Hi, this is our video for medical terminology. This is for cancer medication and cancer therapy. But before we start the video, we just want to let you know the definition for cancer. The definition of cancer is basically the breakdown of the cell cycles, more specifically, where it consistently divides uncontrollably, which can lead into different types of tumors, such as malignant and benign tumors. The difference between malignant and benign tumors would be that benign tumors usually stay in one place. They do tend to split off, they do tend to rapidly grow, but they don't spread to other parts of the body. They don't spread. So it's more in general safer than malignant tumors. It's still bad, however, but benign tumors can be removed depending on the location of where they are. While malignant tumors basically spread throughout the body, they're more metastatic, and they allow other cells to basically become infected, I would say, and it will constantly spread. Going into the different types of cancers, there are different therapies which can target different cancers. These include immunotherapy, radiation, chemotherapy, targeted medication, surgeries, and so on. There are different types of side effects when it comes to all these therapies.
Yeah. Okay.
Common side of effects of cancer. There are a lot of common sides to cancer and the treatments. We have the patient can experience soreness. They can experience hair loss, appetite loss, liver dysfunction. They can also experience sexual dysfunction. Some treatments have their own side effects that they are well known for, like the targeted cell treatment. The patient can experience liver problem based on elevated liver enzymes. Then we have the stem cell. Patients experience infection after the transplants after 6 weeks because of they are not producing white blood cell, while they also experience interstitious pneumonia after 100 days because the same problem when they don't produce a lot of white blood cell because it's a new stem cell. Then also experience graft versus host disease. This is a condition when the new stem cell is being seen as foreign in the patient's body.
The cost of cancer medication has always been on the high side. This is due to the fact that the researchers who take the time to research this kind of drug has to do a lot of investment and a lot of research to bring out the actual cure or actual medication for each different kinds of cancer that we have. And this overall brings the price of cancer medication to be on the high side. Also, another factor that affects the cost of medication for cancer patients has always been the fact that they have to pay for other drugs like that to max the initial drugs. For example, the side effects during their cancer programs, the side effects for radiations and therapies and other stuff. They have to take other drugs and to max this, and in order to do this, it actually brings the cost of cancer medication to a very high price. Another thing, but researchers and doctors have been working hand in hand to figure out the ways to reduce the cost of cancer medication. And one of this has always been that they advise their patients to be open to them, to their doctors or to their physicians about their needs, their financial needs, and about the kind of drugs they take. Because whenever you open to a physician telling him that you're scared of the cost of the medications, these physicians now have to look other ways to reduce the cost of your medication. Another aspect of reducing the costs for medication has always been to enroll in cancer medication programs. When cancer patients do this, it also helps them reduce their cost of medications.
In conclusion, cancer medication has improved a lot in recent years on the effect, but has also increased in the cost of production. Scientists are researching on ways to reduce the side effects of cancer and also the cost of it. The future of cancer medication is promising because newer researchers are done each year on ways to reduce the cost and the effect of cancer medication.